another Aussie Med Tute. Today I'm going to be giving a very basic introduction to anemia, just some peripheral information that could be useful. But remember, if you like these videos, be sure to hit the like button or subscribe. And if you got recommendations, be sure to leave comments. So what is anemia? Anemia is defined as a decreased red cell count and decreased hemoglobin concentration. Different people have different hemoglobin concentrations that are normal for them. It depends on your age and your gender. For males, the normal hemoglobin levels are 130 to 170 grams per litre, whereas for females the normal is 120 to 150 grams per litre. It's important to understand that anemia isn't a diagnosis, it's just another problem caused by the diagnosis. Anemia is caused by a number of things, which we'll discuss a bit more later. What about the symptoms now? The symptoms actually depend on a few things. Firstly, how quick the onset is. Secondly, the patient's general overall health. Thirdly, the severity of the anemia. The symptoms include headache, fatigue, dizziness, chest pains, palpitations, and dyspnea. The most common signs are pallor and cardiac decompensation. The less common signs are angular stomatitis, glossitis, jaundice, and koilonychia. These less common signs are important because they give you a bit of a hint as to what the cause of the particular anemia is. There are a few useful tests for determining the cause of an anemia. These are getting the mean corpuscular volume, a reticulocyte count, and a blood film. I'll go through these each one by one now. Mean corpuscular volume, referring to basically the size of a cell, is between 80 and 100 femtoliters for red blood cells. A femtoliter is 10 to the negative 15 liters. Now, if the red blood cell is below 80 femtoliters and there's anemia, this is called microcytic anemia. If it's between 80 and 100 femtoliters, it's called normocytic anemia. And if it's greater than 100 femtoliters, it's called macrocytic anemia. These different mean corpuscular volumes in anemia suggest a different cause. For instance, microcytic anemia is usually caused by iron deficiency from chronic blood loss, or less commonly from thalassemias. Normocytic anemia can be from acute blood loss, a bone marrow pathology, or a systemic illness. As for macrocytic anemias, they can be caused by vitamin B12 or folate deficiency, they can be caused by liver disease, or by hemolysis. The next useful test is a blood film. As it sounds, this just involves getting a blood sample from the patient and smearing it on a glass slide and then having a look underneath a microscope. Now, different anemias will have different signs on the blood film. For instance, iron deficiency anemia will have small hypochromic red blood cells. As we already mentioned with the mean corpuscular volume, you'll notice that a vitamin B12 deficiency, folate deficiency, or liver disease anemia, all of these will result in enlarged red blood cells, which you can see on the blood film. An anemia due to hemolysis will result in spherocytes on the blood film. The next important test is the reticulocyte count. Reticulocytes are just immature red blood cells, and so normally you should only have 50 to 100 by 10 to the power of 9 per litre. It sounds like a lot, 50 to 100 billion per litre, but it's normal. Reticulocyte count is increased when bone marrow production increases. This can be due to acute hemorrhage, hemolysis, or if iron or folate have suddenly been replenished. Conversely, a decreased reticulocyte count is due to decreased bone marrow production. This can be due to iron, vitamin B12 or folate deficiency, systemic illness, or bone marrow failure. Alright, so like I said, just a short video, an introduction to anemia. Might do some other videos on specific forms of anemia and a little more detail on the biochemical pathways involved. But for now I'm going to end it here. Remember, if you've got a request, recommendation, leave a comment. Be sure to subscribe if you haven't already, and hit the like button if you liked it. Thanks, bye.